Hello, everyone. Welcome. And we're going to give it a few minutes for everybody to get signed in. As you start to get logged in, you'll see a poll that is on your screen. If you could take some time to fill it out, that'd be great. If you would also like to drop in the chat where you're calling in from, you can do so. While we wait, I'd like to introduce myself. My name is Madison Burnett, and I'm a BCBA. I lead our professional development program, and I'll be available to support you through the webinar. In addition to that role, I work alongside other BCBAs on our clinician-led recruitment team, and I support in the effort of recruiting quality professionals to join our team. If you are interested in joining MPG, please indicate so in the post-webinar survey at the end of this webinar, or you can email careers@manhattanpsychologygroup.com. Wow, I see we have a lot of new people joining us.
Oh, yeah. And from all over.
Yeah.
Exciting.
Welcome, everybody. We're so excited to have Nicole talk to us today.
I'm excited to be here.
Very nice.
Wow.
Okay, well, I'm going to leave that open just for a little bit as people start to filter in. But welcome, everybody. If you are new, a special welcome. And if you are joining us, thank you for returning. We will get started with Nicole's presentation in just a minute. But before we do so, I'd like to start off and tell you a little bit about Manhattan Psychology Group. Nicole, can you go on to the next slide?
Oh, sorry. Should I
Yep.
get rid of this poll? Or no? So maybe I can minimize it?
Yeah, we haven't had any new in a little bit, so I'll just end it.
Okay. Just because I'm not.
No worries. All right, so at MPG, we were established in 2011 and have continued to grow our team consisting of skilled adult and child psychologists, neuropsychologists, behavior analysts, special educators, licensed social workers, and ABA therapists. As a team, we're committed to wraparound care, which includes a wide range of our services from mental health and testing to ABA and educational services. This holistic approach allows us to address various needs and challenges with our compassion and care. We provide services to clients out of our Upper West Side and Long Island City offices, in-home, school, and clinic-based settings, as well as through telehealth. Our team is committed to serving individuals, couples, and families of all ages and in diverse settings. We're also pleased to offer these free monthly webinars for parents and professionals where we will continue to learn and foster meaningful connections. At MPG, our vision is to create a future where individuals and their families feel supported, connected, and empowered. Our mission is to provide multidisciplinary, integrated support for individuals and their families who experience mental health, behavioral, and educational challenges. In an effort to stand by our mission and vision, we're thrilled to offer free 20-minute phone consultations for our clinical team, and you can schedule time by visiting our website, or I'll post the link in the chat. Today, we'll be leaving the chat open, but please post any questions you have for Nicole in the Q&A so that we can make sure that they are seen. At the end of the presentation, Nicole has set aside some time to answer some of those questions, but any of those questions that were not answered or anything that you come up with afterwards, feel free to email me and I'll get you in contact with Nicole. Okay, so today I'm going to be introducing Nicole. Dr. Pensak is a clinical psychologist, author, and researcher specializing in treating postpartum mental health, anxiety, OCD, and depression. She is the author of Rattled, How to Calm a New Mom Anxiety with the Power of the Postpartum Brain. She is certified in postpartum mental health and provides evidence-based therapy to her patients. As a Harvard and Yale-trained clinical psychologist, she provides empirically based treatment that is uniquely tailored to meet the needs of each client. And now, without further ado, I'll hand it over to Nicole.
Thank you, Madison, for that wonderful introduction. It's great to be here, and thank you all for attending and for valuing maternal mental health. So you did a great job introducing me. And so as Madison mentioned, I am a clinical psychologist. I'm licensed in New York and New Jersey and all the SIPAC states. And I'm here to talk to you today about how to calm new mom anxiety with the power of the postpartum brain. And this talk is meant to be really informal. So if you do have questions, again, you can post them in the chat or in the Q&A, and I will try to answer them in real time live, but feel free to interrupt. Okay, let's get started. Just Okay. So by the end of this presentation, you will hopefully understand the risks and strengths of the postpartum brain, understand how to harness maternal brain changes to your advantage, create a foolproof postpartum mental health plan, and better understand postpartum experiences, including matrescence, mom guilt, mom shame, mom rage, and back to work transitions. And so just to tell you a little bit about myself and my background, as I mentioned, I'm a licensed clinical psychologist. I'm trained at some of the nation's top academic institutions. I've completed 2 postdoctoral fellowships, one in psychiatric oncology and one in palliative care. I have spent a lot of my career working with patients in academic medical centers with severe medical illnesses such as cancer, transplant. I've worked in a burn unit. And over the years, when working with these patients with really severe medical trauma, I actually prided myself on working with the sickest of the sick. I really enjoyed the challenges of helping them cope in the context of their very real physical difficulties. But then over the years, I became fascinated with a different type of patient, the silent patient in the room, their caregiver. And it turns out that caregivers actually experience a lot of anxiety and depression as a result of their caregiving stress. And more recently, so I built a program of research on the silent patient, the caregivers. And the reason they're called silent patients is because all the medical personnel are focused on the patient and keeping the patient alive, but no one's really taking care of the caregiver. So fast forward, I built a program of research around the caregiver and an evidence-based mobilized intervention to help them manage their stress and make their own mental health a priority. And I more recently applied all of this knowledge to working with scores of women battling postpartum depression and anxiety. And as you know, mothers are also, I feel, silent patients in the room because everyone's focused on the baby. And so I translated a lot of this working with postpartum mothers. So as you can see, I mean, I really considered myself an expert in caregiver mental health and anxiety, depression treatment postpartum. But I tell you all of this because actually none of that mattered when a life-changing experience happened to me and turned me into the ultimate caregiver. I became a mother. And so, despite my expertise, when I became a mother, I experienced my own personal masterclass in postpartum. And I tell you this because postpartum does not discriminate. And I want to break the stigma. So, when I became a mother, I assumed that my maternal instincts would kick in immediately. And because of the ideal images that our society upholds, I assumed that maternal instinct was automatic and baby bonding would occur instantly. I envisioned myself a super mom, right? So that patient, even-keeled, gentle mom that would be able to handle any of the challenges that came up early on. But my fantasies, they were just that. When just days after delivering, I was home recovering from being gutted on the operating table, hunched over in pain, wearing a makeshift padded diaper, trial and erroring football holds and nipple guards, trying to get my baby to latch, and obsessively checking my baby's breathing on my finger at 2 a.m. And it occurred to me very early on that taking care of a baby is really anything but natural. It was also March of 2020, and the pandemic had started, and the walls were closing in. And I ended up suffering from postpartum OCD, obsessive compulsive disorder, the obsessional subtype for the clinicians in the room. Postpartum OCD is characterized by intrusive thoughts, hypervigilance, insomnia, obsessions, planning, checking, and reviewing. Luckily, I had my postpartum mental health treatment team on standby because I follow my own treatment guidelines. So I contacted my psychologist for therapy sessions. I called my psychiatrist immediately. I'd never taken medication before and never thought I would need it. But I'm so glad that I had that provider on standby. So I called them from my closet and they were able to call in the prescription immediately. And all of this was established prior to giving birth. So I'll explain more about postpartum mental health treatment later on, but I just want to give you a sense of what helped me feel better. And so So within 9 days, I actually felt symptom relief. And so that's a very short period of time to feel better. And only months later, fast forward several months later, I actually was thriving. As a psychologist, I was the field's definition of thriving. I was experiencing positive emotions, newfound meaning and purpose, feeling motivated and energized, and more creative than ever. I was painting regularly and even writing a book. As a researcher, as an academic researcher, I wanted to understand, though, how could this be when just months prior, I was curled up in the fetal position, wondering who would take care of my babies, really suffering from a postpartum mental health crisis. So I went back into the research and I really wanted to understand how I was thriving amidst the world's worst circumstances going on outside my door. We were in the COVID pandemic. And I wanted to use this information to help other mothers. And I realized that there's a story that's not being told, and it really needs to be shared today. I'm going to share that, how I went from rock bottom to thriving. And so during this process, I discovered that there are three fundamental factors or pillars, if you will, that help mothers thrive. So let me take you on a journey of a revolutionary way to approach motherhood with the three pillars. And the three pillars are postpartum mental health treatment. The second one is matrescence. And the third one is mom brain, all of which I'll explain shortly. So the first pillar I start with is postpartum mental health treatment. And the reason I start with postpartum mental health treatment is because if you don't have this intact, then you can't get the benefits from the other pillars of matrescence and the power of the postpartum mom brain. But I want to start with the bad news, unfortunately. And it turns out in my discovery of the research that I was not alone in experiencing postpartum. So right now we have a maternal mental health crisis in the United States. And what used to be 1 in 5 is now 1 in 3 mothers will experience postpartum depression. And we also know that these estimates are an underestimate because mothers are still afraid of reporting their symptoms for fear that they will be viewed as unfit. Also, the screening questionnaires don't do a good job of capturing all that is the postpartum maternal mental health experience. So I know that we're missing a lot of women clearly from the postpartum maternal mental health crisis. We know that 13% of mothers experience birth trauma, and that's actually a range that I'll get into later. Postpartum OCD prevalence is more than 4 times higher in mothers versus the general population. Some more bad news. Postpartum mental illness is the #1 complication from childbirth. 90% of new parents experience unwanted, intrusive thoughts. 72% of mothers screen positive for postpartum depression. And first-time mothers during COVID who are now having their second babies are being re-traumatized due to all that unprocessed trauma during COVID. Postpartum psychosis occurs in 1 to 2 out of every 1,000 births. And there's some more bad news. Maternal mortality rates in the US are 32.9 deaths per 100,000 births. We know that marital satisfaction plummets in the early years of child rearing. Becoming a mother is a normative trauma. And I'm not sure if you've heard that before, but we say it's a normative trauma because it's really an assault to every system in your body, biologically, hormonally, emotionally, psychologically, socially. Physiological changes that benefit baby make mothers actually more vulnerable to postpartum mental health conditions. And I talk a lot about this research in my book in more detail. Mothers are biologically wired to tend to the baby's needs. And so it's counterintuitive for them to actually go against the biology and focus on their own needs. Disrupted sleep is the norm for new mothers, but sleep is nature's mood stabilizer. Exercise is nature's antidepressant, but what mother has time? And you're typically not cleared for exercise to 4 to 6 weeks. Motherhood comes with a complete overhaul of one's psyche and exponential, relentless demands 24/7. Risk factors for postpartum include a history of mental illness. It gets worse with each subsequent birth, most likely. And we typically see 2 spikes in postpartum. One after the baby is born and the mother does not breastfeed, or later on, if the mother does choose to breastfeed at the time of weaning, we actually see another spike in postpartum due to the hormonal changes. there's birth trauma, having a NICU baby. These are all risk factors for experiencing postpartum mental illness. And my favorite one is actually that there's this huge health disparity in women's health research. And so only 4% of funding goes to investigating women's medical problems, whereas men's medical health research is known as being overfunded. And I don't know about you, but I've never actually heard of anything being overfunded. So this is, I think, a huge problem. All right, so enough about the bad news. The good news is that we do have evidence-based mental health treatment available. New treatments are being developed and tested every day, and we're moving forward in a good direction. But right now, we do know that there is that evidence-based mental health treatment available. Postpartum mental health conditions are 100% treatable and even curable. And I recently found out, and I'm really excited about this, is that postpartum onset OCD is actually curable, whereas typically OCD is not usually curable. But if you have postpartum onset with no history prior to having a baby, it's curable. So this is why I talk about having a really solid, proactive postpartum mental health care plan. And I tell, my patients this, friends, family, whoever will listen, that once you pee on that stick, I want you to establish care with a therapist and prescriber that specialize in postpartum mental health. For me, having a psychiatrist on standby meant that I didn't have to scramble last minute to find a doctor or wait 3 months for an appointment. And when I needed her, more specifically, when I called her from my closet, she was able to call in the prescription immediately. And the therapy sessions helped as well. And so the issue is that now we don't have a proactive postpartum mental health care system. So unfortunately, the onus still falls on mothers to set this up. So what you want to do is establish care with a therapist and a prescriber, even if you don't think you will need it. The reason I share my story is because I went into it with a certain type of hubris. I thought that I was immune to postpartum, and it happened to me despite my expertise. And and so I really want to break the stigma with that, and so that you have it on board. By the way, if you do have postpartum, it's really hard to problem solve last minute and think about how to set up a mental health care plan when you're, trying to feed the baby and lack of sleep and, suffering from a mood disorder. So that's why I also recommend setting it up proactively. Also, it can take months to get into an appointment with a provider. And sometimes it takes a couple tries to figure out what provider you want to work with and who you're going to establish rapport with. By establishing a proactive postpartum mental health care plan, you can also understand your unique personal risk factors, right? And you can plan that postpartum timeline accordingly. So for example, if you are someone who has a history of bipolar disorder, you would be at heightened risk for postpartum psychosis. So your postpartum mental health care team will know to check in with you very early on after having a baby. And right now, I think the standard of care is 6 weeks, but I recommend that all providers check in with their patients within 2 weeks. And for postpartum psychosis risk, even earlier. When I was writing Rattled, I did a lot of research. I spoke to a lot of experts around the world that are doing maternal brain plasticity research. And what we do know now is that the 1-year cutoff for postpartum mental health disorders is actually arbitrary. It actually can occur, at any time after having a baby, up to, 2-3 years. And if you have your second baby, you're at higher risk as well. And so I really want to encourage providers and mothers and partners that the 1-year cutoff, you're not in the clear if you get through that first year. The reason being is that, again, we don't have a lot of research on mothers postpartum. And so our long-term follow-ups typically stop at 2 years. And that's why we don't have any data really after that. And so it's limited. But just to let you know, the 1-year cutoff is arbitrary. Also, I feel that the diagnostic screening assessments don't really capture the essence that is postpartum, right? So everyone knows the Edinburgh is being used in most OB offices, but You really need to have time to talk about what's going on in your experience of becoming a mother and the symptoms that you're having. For example, what can look like, just taking care of a baby, like, oh, I just check on her at night and, um, I check her breathing, whatnot. Well, I'm going to probe further and ask, okay, well, how many times are you checking? Are you able to fall asleep? Are you staying up worrying about the baby, right? And so some of the diagnostic screening assessments just don't capture all of the details that we need to really diagnose postpartum. And that's why it's also important to have a team that specializes in postpartum. All right, so I've told you the first factor in motherhood that we need to consider to help mothers thrive. And the second factor is called matrescence. And you likely have never heard of it. Turns out becoming a mother is its own developmental phase, like adolescence. Matrescence is now found by researchers at Yale to be a profound neurocognitive phase of development. And so during this transition, your brain changes rapidly, fine tuning and priming itself for new learning and shedding useless neural networks known as synaptic pruning. I'll get more into the brain changes later, but other things change as well, as I mentioned. So the relationships, your roles, hormones, and psyche, all of it changes. It's just a profound transition and transformation. It's a completely transformative process. And in my book, Rattled, I talk about how to harness all of these changes to your advantage. But I also think that we need to shift becoming a mother, this matrescence period as an opportunity, right? It's an opportunity to dig deeper into ourselves and learn how to make the most of this phase. And what better motivator is there to wanting to be the best versions of ourselves for our children? But with every opportunity, with every period of neuroplasticity, enhanced neuroplasticity, there are risks. There are risks. And Rattled is my guide to navigating them. Also, when you become a mother and going through matrescence, you're navigating new emotions and experiences. All of the skills that I offer in Rattled are based on evidence-based treatments, such as cognitive behavioral therapy, where thoughts, feelings, and behaviors are all related. I talk about behavioral activation for depression, exposure for anxiety, exposure and response prevention for postpartum OCD, and also the tenets of cognitive behavioral stress management. So one of the main new emotional experiences that mothers tell me that they feel, and we hear a lot about, is mom guilt. And I want to share with you that I look at mom guilt more on a diagnostic continuum. So I'm going to look at how often are you experiencing mom guilt? How bad is it? And does it interfere with your quality of life or daily functioning? And so mom guilt is I did something bad, as opposed to mom shame, which I am bad. And I'll go into mom shame later, but for mom guilt, an example would be, I feel guilty leaving my baby while I go out. And so when we talk about cognitive restructuring and reframing, the healthy reframe for this mom guilt would be, it's important for my baby to learn that I will leave and always come back. And so to keep that in mind when you're having sort of these feelings of mom guilt and leaving your baby. Mom guilt also says, I feel guilty that I feel ambivalent about motherhood, love, and hate. And the healthy reframe is that ambivalence is the hallmark of motherhood. So mothers are constantly going to be in this push-pull. I love my baby and I need a break, right? I love, cuddling my baby, but I hate everything that goes on with diaper changes and lack of sleep. And this is all really typical. And so I always say that "and" is the most important word in therapy. And so we want to bridge the gap and allow for all of these feelings, both the conflicting feelings in motherhood. And so I have a very specific method that I talk about in Rattled. It's called the double down method for mom guilt. And what I do is, there are other strategies as well, but for the sake of time, I'll go into just this one. So the double down method is basically that I encourage mothers and my patients when I work with them to lean in and make the experience bigger, better, and more pleasurable. So if they're going out, to socialize with friends, I'm going to encourage them to try to put their preoccupations to the side, worrying about the baby. And how do you make that interaction more enjoyable. Maybe you get your favorite meal or favorite drink, or you engage in a conversation that's enjoyable, but you really actively try to get the benefits of the socialization. Because the reason being is that if you are preoccupied the whole time, you're not getting the benefits of doing the very thing that you need to experience less mom guilt, right? We know that if you're feeling more depressed, you're also going to experience more mom guilt. So really the antidote is to fully engage in these pleasurable experiences and get the benefits from that. And that in turn will reduce the experience of mom guilt in the long term. I see a lot of this when I work with mothers going back to work as well. And so I encourage them to, when they're at work, and of course it's a transition, it's an adjustment, but I encourage them to think about different ways that they can work differently at their job. Maybe they ask for, getting involved in a new exciting activity that will encourage them to be more creative, or they take more breaks to socialize, to have a coffee with someone, and in that way they're really bringing themselves into the present and getting the benefits of being at work, and not just being preoccupied by the baby at home, because that really doesn't do any good and will probably make your mood worse. And then if your mood is worse, again, you're going to have the increased mom guilt. The next one is mom shame. And again, I look at this on a continuum, where I'm looking at how often are you experiencing mom shame? How long does it last? And does it interfere with your daily activities or daily functioning? Are you avoiding activities because you feel ashamed? And again, as opposed to mom guilt, where mom guilt is I did something bad, mom shame is I am bad. So it's more of like a core belief. And so mom shame says, I don't have maternal instinct. Something is wrong with me. Again, you're seeing that core wound. A healthy reframe would be maternal instinct is a myth. More commonly, it's trial and error practice over time. And that's what we know now from the research, is that maternal instinct is not a thing. All right. It's just trial and error over time. And so what I encourage my patients to do, and when I work with different mothers, I talk about softening on mom shame. So I want you to speak to yourself the way you would a friend, right? Tend to your own needs. What do you need now to feel better? Be kind to that, that shame, that inner child. Are you carrying an old wound from your childhood? Is your inner child feeling criticized? And so how would you tend to that? You would be more compassionate. If a friend said this to you, you would be nice. And so I encourage you to do the same when it comes to mom shame. The next emotional experience, which is pretty common with mothers, is mom rage. And so mom rage is this intense anger, but it's more than that. It's like feeling triggered, and it's just all consuming. And I liken it to an action potential with, once it's released, it's like you can't stop it, right? It has to sort of run its course. And so Anne Lamott, she wrote this great book called Operating Instructions about her experiences early on. And she talks about her quote, and I put it in the book, is be prepared to dance with your feelings, right? All of them. And mom rage is one of those feelings. It's excruciating, but it's pretty common. But we know now some of the causes of mom rage are due to overstimulation, hormone changes, the increased mental load, having so much responsibility, and the relentless tasks of child rearing that are 24/7, as well as lack of sleep. And so what I encourage moms to do is, again, remember, it's an all or none phenomenon. Once that fires, what you want to do is you kind of need to ride it out. There are some ways you can sort of slow it down. I encourage you to leave the room, take a break, breathe, actually move your body in slow motion and kind of let it run its course. But I also focus on, my number one rule is don't make it worse. So when you're in mom rage, you're probably going to want to argue with your partner or yell at your other kids. Don't take the bait, right? Don't make it worse. Mom rage is bad enough. Try to just sit with it, let it ride out. And then after you're feeling better, perhaps there is some room to analyze what caused the mom rage. Maybe you need to have a proactive, assertive discussion with your partner about division of labor, which I'll get into in a little bit. But in the moment, I don't want you analyzing it. I just want you focused on slowing down, breathing, and riding it out. Other topics that I go into in the book that are part of this matrescence and transition to motherhood is, I hear this a lot, baby bonding. Mothers feel that something's wrong with them if there's not this immediate connection to their baby. And what we know from the research is that it really often takes months. And so I want to encourage you as practitioners and as mothers and partners, be patient, kind to yourself, trust yourself that it's going to take time for this relationship, like any relationship, to develop. And if it's, so, for the mothers that do experience that immediate, influx of feelings and love and overwhelming feeling, I think that's wonderful. I'm not trying to minimize it. I'm just saying that it's not, more typically it takes time, right? And a lot of it can be projection anyway. Um, All right, so that's baby bonding. Okay, so then I talk about relationship changes. So as I mentioned before, marital satisfaction basically plummets in the early years of child rearing. So if you're not having your best years, don't get discouraged. You're probably in the norm. And so in my book, I talk about different relationship strategies. My golden rule again, don't make it worse. Like it's a challenging time. How to just get through it and then minimize the damage that can be done. And so I draw from John Gottman's relationship research, and he talks about the four horsemen: criticism, defensiveness, contempt, stonewalling, and then provides antidotes. And I'm going to just show you the book here because I want to mention an important part of the book. I have these boxes, and they're called snapshot boxes in each chapter. And I encourage my readers from the beginning to take pictures of the snapshot boxes and basically name an album in their phone. And it's basically so that mothers can refer to this at any time. You can keep it, it's right on your phone. You can have it, when you're in the bathroom, when you're, in the pantry, whatever, going for a walk with your baby at the park. You can always refer to it, and it gives you little coping cards of tips on how to take away all of these really practical strategies. But I wanted to just get into the relationship aspects and the four horsemen. So criticism is verbally attacking a partner's character. You don't want to do that. So Gottman describes these four horsemen and then gives antidotes for them. So the antidote for criticism is using I statements and acknowledging a positive need. So for example, I understand you didn't mean to hurt me, and your action made me feel less than. In the future, I would appreciate you not using that language. The next one is defensiveness. So claiming to be the victim when faced with confrontation and not taking the partner's perspective into account. And the antidote is to accept responsibility. So for example, that was not my intention, and I see that I hurt you. I apologize. Contempt is hateful acts such as intending to abuse or insult the other person. And the antidote is try appreciation and gratitude and be very specific. For example, I appreciate you being direct. You're always able to come to me and tell me how you feel. I'm so grateful to have a partner that is honest with me. And the last one is stonewalling. Stonewalling is this pathological avoidance and withdrawal from the relationship. And so the antidote is to take a break and come back to discuss this issue later. So for example, you would say, I'm feeling overwhelmed right now. I want to give this matter the attention it deserves. I'm going to take a break for 30 minutes. And when I come back, let's sort this out together. I also talk about different ways to establish assertive communication in your relationships and bids for connection. That's also one of Gottman's things. So basically, he stipulates that there needs to be a 5-to-1 positive to negative experience ratio within your relationship for marital satisfaction. And so what you want to do, it doesn't have to be big positive experiences, but let's say your partner comes in and says, hi, honey, how are you? You're going to want to look them in the eyes and respond. And that counts as a bid for connection. And so you look for opportunities there. And it's really hard in early parenthood to sort of connect in that way. But again, it doesn't have to be huge. It can be these little moments. Another thing I talk about in the book that's really helpful for couples is the division of labor aspect. So Eve Rodsky has a great book called Fair Play. You may or may not be familiar with it, where she provides tactics for fair division of labor. And what that means is that you have proactive discussions about distributing the household and family tasks between each partner. And when you delegate a task, when you take responsibility for a task, you need to be 100% psychologically responsible for the entire task. So, for example, if you take the task on of taking care of the garbage, you're the partner that needs to pay attention to when the garbage is filling up. When the garbage needs to be taken out, you take it out. You got to be aware of the trash pickup times, take the trash cans back in, and then put the trash bag in the trash can again. And so it doesn't count if you rely on the other partner to say, take the trash out now. That does not mean you're psychologically responsible for that task. And so it's really important that partners have these discussions early on, because there are so many relentless tasks associated with taking care of children and managing a household. And so these are ways that you can proactively distribute those tasks early on. And you have to be flexible in terms of having these conversations regularly, because they may change depending on the different developmental time points of the children. And I talk about the mental load of motherhood, and that helps sort of reduce the mental load when you can delegate some of the psychological responsibility of the tasks. All right, so I also talk about back to work transitions and how mothers are a good return on investment. I am encouraging and advocating for companies to provide paid parental leave up front and to actually invest in the maternal brain. And also for, again, counseling patients, I want to tell them about, to understand that the way you work may actually change. I know when I was working in academia, I could work for hours at a time prior to having kids and write and be engaged, get into flow, which I'll also talk about in a little bit. But when you have a baby, you're going to be more interrupted, either with the tasks of like pumping when you're back to work, or other, reminders of the baby. Also, if you're home with the baby, you're not going to, while the baby naps, you're going to be interrupted. So you want to be flexible and curious about a new way to approach your work. I also talk about changes in identity and adjustment, and matrescence is really a huge adaptation. And so I encourage mothers to be flexible and curious, and it's really an opportunity to discover who you will become at this phase. Say goodbye to the pre-baby person. We are going to discover a whole new person. And so I talked about the first two pillars of motherhood, the postpartum mental health treatment, and then this huge developmental phase of matrescence. But now I want to talk to you about the power of the mom brain. And as I mentioned, becoming a mother involves a lot of maternal brain changes. I like to say that, basically Marie Kondo's your mind to give moms a leg up in caregiving. Your brain changes rapidly, fine tunes and primes itself for new learning, sheds useless neural networks known as synaptic pruning. And so the most recent research, which I think is important because you're probably more familiar with the derogatory term mom brain, and it's when a mom makes a mistake or has a lapse in memory, they're seen as being, weak, or it's a dysfunction or a deficit. But really, nothing could be further from the truth. The maternal brain is brilliant. And when we look at the research studies, there's actually really weak support for significant differences in memory functioning between mothers and non-mothers. And so we know that the subjective experience of feeling foggy and forgetful is very real, that mommy brain subjective experience, but that's most likely due to sleep loss and increased mental load. So we really need to understand the full picture of the mom brain. And actually, mothers compared to non-mothers demonstrate better emotion regulation, mental flexibility, and visual memory. But despite these gifts, our society really upholds this, stereotype of mommy brain being a deficit. And so mommy brain really needs a rebrand. I mean, if you think about everything that the mom is responsible for, the maternal brain really is brilliant. Think about all the relentless tasks and the demands that a mother is forced to rise to 24/7. All of this new learning, problem solving, and enhanced resilience is actually shaped through experience-dependent neuroplasticity. So basically, the environment is forcing the maternal brain to rise to each challenge and evolve. So, in addition to all of that experience-dependent brain development, we also have the potential to develop ourselves even further due to post-traumatic growth. So, I don't think we can talk about motherhood without talking about trauma. So, as I mentioned, becoming a mother is a normative trauma because everything changes so quickly. It's an assault on our system. Um, Also, 13% to 46% of mothers experience a birth trauma. There's also childhood trauma that we bring into our experience as becoming a mother. 1 in 3 women experience a sexual assault. And so it's really an opportunity to bring more mothers to this other side of post traumatic growth, where they feel newfound meaning and purpose and increased resilience. Let's see. And so the way that we do that, you may wonder, all right, so how do we facilitate post-traumatic growth? Well, there's a phenomenon called self-directed neuroplasticity where our thoughts and actions can actually have an influence on all of these neuroplastic changes. And so I encourage mothers to sort of ride this wave of neuroplasticity. And as our brain is evolving to tend to the baby, let's learn to tend to ourselves and take care of ourselves. And so we do this through behavioral changes. Exercise is one of those activities that really nurtures neuroplastic processes, rising to relentless challenges. Every time you problem solve, for example, figuring out how to soothe your baby, your brain is sort of developing a neural network around that. And so I don't know if you've seen Inside Out 2 yet, but it was a fantastic depiction of how we develop these cognitive schemas and feelings and core beliefs. And you can imagine these neural networks being formed in our brain around all of these new motherhood tasks and demands. Um, Other activities that I recommend in the book, I like to give mothers really practical strategies that they can do, in the moment, day to day. And so I recommend distracting activities, call a friend, exercise, go for a walk, listen to a podcast, read a book, listen to music. I tell them to grab, an old book and go line by line and circle every other A. It's really hard to do that and sort of worry at the same time. I encourage deep breathing. So you want to practice deep breathing, the 4-7-8 diaphragmatic breathing 2 to 4 times daily for 2 minutes. So that will allow you to do 8 rounds of diaphragmatic breathing, and that's really soothing and protective. I also encourage mindfulness exercises. So the 5-4-3-2-1 exercise is a great one. So name 5 things you can see, 4 things you can touch, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. And what that does is it brings you back into your body, into the present, and out of your head. Um, I also recommend listening for the most distant sound you can hear. So what you will do is, sit in your chair, take some deep breaths, close your eyes and listen for the most distant sound you can hear and keep going further and further. And again, it brings you into your body, into the present. They say anxiety and depression are disorders of time. Anxiety, you're worrying about the future. Depression, you're thinking about the past. And so in the present moment, if you can bring yourself into the present, there's no anxiety and no depression. And these strategies really help to shift your mindset. All right. I also recommend mommy worry time. So if you are finding yourself consumed with worry, as most new parents are, I would schedule 10 minutes daily for worrying. And what that does is it sort of contains the worrying. So if you have worry thoughts that come up outside of that scheduled 10-minute time, you're going to say, I'm not going to get into this now. I'm going to write this down. I'll go through this later. And then later, you'll have your worry time. You'll be able to think or process whatever it is that's coming up for you. I also recommend this for grieving over shadow losses, disappointments. Maybe you didn't have the ideal birth experience you wanted, or gender disappointment. That would be that time where you process this. You set a timer. When the timer is done for 10 minutes, then you follow that up with a pleasant activity. I also encourage mantras like adopting mantras, I don't want to, and I will, or it doesn't have to be perfect to be okay. I think when, social media and all the images out there of the perfect mother, the ideal mother, mothers put a lot of pressure on themselves to be perfect. And so I really want mothers to be more forgiving and to say, it really doesn't have to be perfect to be okay. My baby is not going to, die if I do things a little differently. How are we doing on time, Madison, by the way? I
You have
can't.
about 15 minutes left.
Is that for discussion or presentation?
Total presentation.
Okay. All right, good. Then I can slow down a little bit. I feel like I'm talking really fast. Okay. So these are some of the coping strategies that I recommend. I also introduce a concept called mom flow in the book Rattled, and you're probably all familiar with the term flow. It's this transcendent experience where you really, get lost in an activity. It's really enjoyable, pleasurable, but you kind of lose um, you lose your sense of time, right? You get completely immersed in it, and it's really restorative. But as I mentioned before becoming a mom, you probably had hours at a time to engage in a task that you love, or a creative activity, or writing, or work even. After you become a mother, time becomes sparse, and very interrupted. This is very common. And so for mom flow, I encourage mothers and parents alike to schedule time for their activities, but even if they only have 20 minutes, to sort of get themselves in their present body, do some deep breathing, accept that they only have 20 minutes, and then immediately get into the activity. And when the thoughts come in, like, oh, I only have 20 minutes, or I'm going to be interrupted, or the baby's going to wake, or whatnot, you kind of let those thoughts go in and out of your brain without judgment, kind of let them pass, right? Acceptance. And you keep going with the activity. And what you're doing is you're sort of exercising this muscle to get into flow, to train your brain to get into flow again in shorter increments of time. And so let's say, you're painting and then you get interrupted, right? You didn't quite reach flow, but you were starting to get into it. And then the baby wakes up. It's like, okay, so what I encourage parents to do at that time is to try not to get frustrated. It is frustrating, but try not to stay there and move right into gratitude. I'm glad I had this time. I will try again next time. That way, you're sort of being appreciative for the time that you did have. You're not feeling more frustrated, and you're encouraging yourself to try again. And then by continuing to practice in these briefer moments and getting engaged more quickly in the activity, you're going to start to feel yourself get into mom flow a little faster, and you're going to get better at it. And in that way, you'll be able to get the benefits of experiencing flow, the mood boosts, and the creative energy that comes with that. And this is all towards getting the most benefits out of maternal brain plasticity and taking it even further, right? So it's not just about treating postpartum mental health disorders. That's like a given, that's standard. What we want to do is think of matrescence as this opportunity of this brilliant maternal development, brain development, and how to bring it further. And by doing these exercises from positive psychology that has a lot of research behind it, you're going to bring your brain into the best shape possible and get into thriving. Back in the day, they also used to prescribe knitting for things like depression. And so the reason being is that if you engage your hands, it does something with your motor neurons, or mostly in the areas of your brain that are also responsible for feeling anxious. And so what you want to do is, if you can engage those motor neurons in an activity, right, so knitting, gardening, ceramics, anything with your hands, it's really going to help you with that mood, with that anxiety, with the depressive feelings. So I always encourage doing something that can engage your hands. And then also, we know that therapy can rewire the brain. So it is an opportune time for parents to be in therapy. And mothers, I know you're thinking, well, who has time for therapy at this point? But again, this is an opportunity to invest in yourself with time, to have an objective thought partner, even if you're not suffering from postpartum, to sort of think about things in a different way and adjust, and um, figure out how to make the most of it. And it can really rewire the brain in positive ways. Um, and so I always say that I actually think that my therapy went that much further when I was recovering from postpartum, because my brain was in this prime state of learning, right? And adaptability. And so I think that it's an opportune time for a lot of mothers, for most mothers, to experience this as well, right? Your brain is like a sponge. It's learning so much about taking care of a baby. So why not learn about how to take care of yourself at the same time? And again, I talked a little bit about this before. You're going to want to lean into pleasure. So let's say you're rocking your baby, and I'm going to encourage you, maybe you're like bored, or you're tired from lack of sleep. I'm going to encourage you to take advantage of that interaction with your baby. And I want you to sort of lean into pleasure. Think, how can I make this more enjoyable for myself? Not for my baby, but for me. I'm going to encourage you to smell the baby's hair, maybe play some soothing music, read an enjoyable book to the baby, but to yourself. But I'm saying that, what do you need to make this better? Maybe you have some, good smelling lotion that you can put on your hands, or, smell it, give the baby a little massage. But what I really want you to do is lean fully into, how do I make this more pleasurable for myself? Because that's where you're going to get the benefits of the mood boosting. And in turn, you're going to feel, less depressed, less anxious overall, less mom guilt, less mom shame, right? So really going above and beyond and leaning into the positive, not spending this time worrying about the baby. And when we're worrying about the baby, essentially our brain likes to make up a lot of stories, and typically they're negative. How do I protect my baby? Our brain is kind of wired to do that, right? Thinking of all the potential um, catastrophes or dangers, right? What I would say is that you're still making up stories when you have anxiety. So what you want to do is, instead of making up the negative stories, make up the positive stories. So imagine your baby, reaching certain milestones and you enjoying certain activities with them. Visualize them as like older adults and really thriving in life. So if you're going to make up stories, you might as well make up the positive ones, and you really have more control over your thoughts than you think you do. And these can really shift your mindset. Okay, so for the future of mom brain, what I like to do, I'm advocating for legislator really needs to fund parental leave. And I actually encourage companies, and I talked about this in my TED talk, to incentivize maternity leave upfront. You really need to fund leave upfront so that mothers can pay for treatment and for instrumental support. There was a great study where they gave impoverished mothers, I believe it was $333 each month for a year. And the results were that there was increased brain activity in their babies, because mothers were able to, they think, right? That mothers were able to engage with their babies more. So happy mommy, less stressed baby. The mothers didn't have to worry about how they were going to afford diapers, and they could potentially pay for mental health treatment. And so we're really, by doing this, by really investing in the maternal brain and providing resources and setting this up for success, you're really changing the culture and setting up the next generations for success. I also hope that we're moving in the direction of evidence-based postpartum treatment being standard of care and streamlined, so that every mom will have postpartum mental health care set up for them the way that you would have your standard, OB follow-up and pediatrician appointments for the babies lined up. I don't think we're there. We're definitely not there yet. And I don't know, it might take decades to get there. And that's why I really am advocating. Unfortunately, mothers, the onus still falls on you. So please set up your postpartum proactive maternal mental health care team, just in case you need it. And I think from the numbers, we're seeing that you might. It's likely. And so just to review, rattled, we want to view motherhood as an opportunity to promote thriving through these three pillars: postpartum mental health treatment, matrescence, and the brilliant power of the maternal brain. In sum, Rattled is more than a book. It's my call to action to dismantle the barriers to maternal well-being and usher in a new era of empowerment and resilience for mothers everywhere. In this way, matrescence can resemble more of an employee development program with enhanced skills, brain power, and assets to employers versus a mental health crisis. And together, we can rewrite the narrative of motherhood, transforming trauma into triumph and despair into hope. The journey may be arduous, but the destiny is nothing short of revolutionary. And so I want to thank you for your time. Please reach out to me. Let me know if you have any questions. I'd love to open it up for discussion. As I mentioned, I'm a psychologist. I have a private practice, and I'm currently accepting new patients in New York and New Jersey, and also throughout the states that are covered by SciPact. You can email me if you're interested in working with me at drnicolepensak@gmail.com, or you can call me. I'll have my number up there. You can also check out my website. I would also love if all of you follow me on Instagram. That's where I post a lot of my book updates and book tour and mental health, my podcast that I'm appearing on, and information to help promote maternal mental health. My Instagram handle is at Dr. Nicole Pensak. And then the book Rattled, it's a great gift for all new mothers. I have to plug it here. I tell mothers to put this on their registry. And then also you can buy it at any major bookstore. It's on Amazon. It's at your support local. And then if you do read it, please leave a review on Amazon and Goodreads and let me know what you think.
Yeah, and everybody can find that link in the chat also. Okay, so there are a couple questions that came in the Q&A. Can you see those, or would you like me to read them?
Okay, I see the first one. I see both of them actually. Okay, so the first one is from Kristen. Are there any books on postpartum OCD that you recommend? So specifically, I don't know of a postpartum OCD book, except that I definitely cover this in Rattled. So Rattled would be a good book for that. But I also recommend Edna Foa's book, Stop Obsessing. It doesn't cover postpartum OCD specifically, but it's a great book for OCD, and the treatment is still the same for postpartum OCD as it is for not postpartum OCD, except I think we would do the exposures a little differently in terms of like the in vivo, but we can get into the nuances about that if you have more questions. The second question from Dawn is, what are ways we as clinicians can in our own states make this standard of care and connections with OB and even L&D offices in our area? That's a great question. So of course, I'm going to recommend that you connect with Postpartum Support International. I think that they have a lot of great resources that are free for patients. They have support groups for everyone. They have a million different types of support groups. So that's a way to get it affordable, which I think is a nice way to refer, patients in OB and labor and delivery for their practices to provide an affordable option. I think that, what I do is I actually just go and I speak to the practices in our area. I have meetings, so, Zoom meetings and whatnot, phone calls, or in person, I stop by their practices and I drop off materials. I talk to the doctors individually, about how they can better support their patients postpartum. So, it's a lot of work. And I would also say that if you are interested in providing, this science-based book, we do offer bulk pricing that you can provide the book for your patients, and you can contact me if you're interested in providing Rattled for your patients as well. It gives a nice summary of how to engage in treatment and what to think about.
Okay, perfect. If you guys have any questions that you think of after we end the webinar, feel free to either email Nicole or get in contact with her on any of her platforms that you see on the screen now, or you can also email professional development at manhattanpsychologygroup.com, and we'll definitely connect you with Nicole. All right. So on the next slide, you will see some socials for Manhattan Psychology Group. If any questions do come in, we can post the responses here. You will also see us posting this recording on our website so that you can, refer back to it, or you can link it to anybody else that might need some extra support. Again, Nicole would be a great resource for that. And then on the next slide, you'll see some links that will be helpful for any upcoming webinars for both ABA and mental health. And there's also the link for any previously recorded webinars. This is the end of today's webinar, but if you have any questions, I will definitely stay on for a few minutes to assist, or you can also email us at professionaldevelopment@manhattanpsychologygroup.com, which is also on the screen and in the chat section. So thank you so much, Nicole. It was great to have you, and thank you everybody for attending today's webinar.
Thank you. Thanks for having me. Thanks for your interest in maternal mental health.
Yes.